Yeah. Hey, everybody, we're back here with Dr. Sanjay Gupta. Let's talk about, you mentioned that, if you are exposed to this, you might be tested and, find out that you've been exposed,
Yeah.
and then people that you exposed have to be quarantined. How do you get tested? Have you been tested?
I've not been tested. I don't think everyone needs to get tested. I think doctors need to make good judgment here. I don't think you don't want to cause panic by just saying everyone should get tested. It's 350 million people.
The president has said last week that there are tests out there for everyone. Presently, tests for everyone. They're beautiful tests. They're great tests. Everyone who wants a test can get one today. As of yesterday, he said. Is that true or false, Sanjay Gupta?
It's false.
Okay.
And it's sad because there's so many things that work so well with our healthcare system. I'm a member of the healthcare system. I think there's so many things that work. We failed with regard to testing in this country, and I'm...
Why, though? We do have excellent medical professionals and fantastic medical technology in the United States. Why don't we have a test? And why did we refuse the German test?
Well, with regard to that second question, I think that's a really interesting thing. I mean, I think we get very provincial in the United States. If it's not stamped with a Made in America sign, we tend to think of other things as inferior. Things from other countries, we automatically think they're not going to meet our standards. And, that wasn't the case. Those tests were good tests. They got out there and they...
Is that the test that's being used elsewhere in the world? Like, are
Yeah.
the Koreans using the German test?
The World Health Organization sort of adopted it, and it got used in many countries. The South Koreans did, and they're using it in many countries in Europe. So,
do you know if there's a test being developed right now? Like, is there going to be a test soon that can be mass-produced in the United States?
yes, there is a test, and there has been a test, but it wasn't... they tried to scale it up and send it out to all these places. That initial test was flawed. It didn't work. They couldn't count on it actually giving conclusive results. They pulled everything back. They said, we're going to do everything out of the CDC. And what's striking to me, just even this week, Stephen, if you go to the CDC's website, and we've been talking about this for 6 weeks. I feel like I've been screaming into the abyss. And frankly, you get a lot of pushback, especially on social media, people saying, you're fear-mongering. Why are you being so critical? And even if you go to the CDC's website now, 0 tests by the CDC on some days this week, 8 tests by the public health departments, 8, period. Not 8,000, not 8 million, 8 tests total by our public healthcare system.
And meanwhile, how many tests are they doing in, say, South Korea on a
South
daily
Korea
basis?
was doing 10,000 a day for a period of time. So we don't have, as people have said, we don't have eyes on this thing. Mm-hmm. It's often described in sort of hunting metaphors. I'm not sure if it's an appropriate metaphor or not, but we don't have eyes on this. We don't know what we're dealing with exactly in this country. Even these numbers that are coming out today, which have gone up significantly since last week when there was 15 cases, now there's more than 1,000 cases. I think that's a gross underestimate of what's actually happening here.
Well, let's talk about the address the president gave to the country last night. Presidents rarely speak from the Oval Office, only times usually of crisis. Yeah. Last night, the president announced a European travel ban. European leaders were caught flat-footed. They were not given a heads up. They denounced it, and global stocks plunged overnight. Is there value to what the president proposed, or is it the barn door is shut?
Yeah, I think that metaphor is appropriate here, Stephen. I mean, people will say, what about the travel ban on China back in January? You remember 195 Americans brought in by that flight and then put in quarantine at that Air Force base. Huge move. That hadn't happened in 60 years in this country. Last time that happened was smallpox. It was a big decision, to do this. The problem now is that there's a lot of cases of coronavirus in this country, and they're spreading in communities. So you'd really have to justify why you would do a travel ban from countries that may have similar numbers of coronavirus cases as we do. And again, we don't really even know how many cases we have because we haven't been testing.
As a medical professional, have you heard from the administration a rationale as to why continental Europe may be cut off, but the UK is not, or South Korea was not?
Yeah, I mean, they did have these level 3 restrictions in South Korea, so they had some, the no non-essential travel and things like that. But no, it didn't make a lot of sense, especially given that we're talking about a little strand of RNA here that doesn't respect borders, it doesn't respect boundaries, it travels freely all around these places. So the fact that you could arbitrarily say this, and by the way, Stephen, you look at what's happening in China. China is now saying, we don't want other people from these countries coming to our country because we finally got this thing under control.
They announced that they believe that they're past the peak of the epidemic.
That's right.
What did they do that we could learn from the Chinese?
Well, China was, they were very heavy-handed. I mean, maybe a little bit slow out of the gate, depending on how you look at what was going on there in November and December, but very heavy-handed. They basically had the largest quarantine ever recorded in the history of the world. 60 million people under quarantine over there, not letting people in or out, really trying to contain this virus. That's containment, which is different than mitigation, which is just slowing the spread of it. Containment was the name of the game over there, something that could happen in China, and I think you saw the beneficial.
Can that happen in the United States, though? Because, for instance, Wuhan was the first place that they contained, and the area around it. That city itself is 11 million people.
Small Chinese city, right?
Exactly, a small Chinese city. It would be the equivalent of saying no one in the New York metropolitan area can go in or go out.
Yep.
Are we headed that way?
I don't think we could ever do what they did in China. In order for quarantines like that to work, first of all, you have to do it early. You have to be very consistent, and everyone has to be super honest about this. In China, it was mandated. I mean, it's a different rule of law there. I mean, everyone talks about this, the autocracy and what that really means when it comes to government. And in many ways, there's a lot of negatives, but with this particular situation, they were able to do something that I don't think can be done in hardly any other places of the world. But one thing I do want to point out is that they're not the only model of success. I'm optimistic. You look at Singapore, you look at Hong Kong, Stephen, borders mainland China. They've had about 120 patients diagnosed in Hong Kong. So there's different things that can be done, but they have to be done. They have to be done early. The testing is critical to that. And then all these other measures that we're talking about in terms of social distancing can have a real impact.
If you can stick around for just one more act, we have to take another commercial break. But come right back because we'll have more Dr. Sanjay Gupta talking about coronavirus fact versus fiction. Stick around.